Stay with us as
the exact amount of oxygen in a tumour, and that should allow doctors to gauge the exact doses of chemotherapy and radiotherapy needed by the patients. Our health editor Lawrence McGinty reports.
Scientists have developed the new device to measure oxygen in cancerous growths. A probe in this test tube demonstrates the principle. As oxygen is bubbled through, it reacts almost immediately to register levels of the gas. What's crucial is that the very fine probe, almost too fine to see, can be inserted directly into tumours in patients.
It's been known for many years that in the case of cells, tumour cells that don't have a lot of oxygen, they are some 2 to 3 times more resistant to radiation treatment. So radiotherapy is not always effective in the case of these poorly oxygenated cells.
Doctors say knowing how much oxygen there is in a tumour could allow them to design the right treatment for each patient, to customise radiotherapy and chemotherapy.
This is a very important technique now, and it helps us to move a lot of our treatments on, particularly as the treatments coming out of the laboratory, a lot more of them are based on blood flow and changes in blood flow. So areas where the blood isn't delivered, that haven't got the oxygen, we need to know about these areas now, and now we have a technique for measuring them.
The new device can also be used with modern techniques like MRI scanning to pinpoint exactly areas of low oxygen in a cancer. Trials of the new device involving patients will begin later this year. If they're successful, it could become a routine measurement, not only for treating patients with cancer, but also in other fields of medicine, like plastic surgery. Lawrence McGinty, ITN, at the Cancer Research Campaign.
Well, we mentioned before that this is just the latest in a number of key breakthroughs in cancer treatment. But how much progress is really being made? Well, I'm joined now by Dr. Leslie Walker from the Cancer Research Campaign. Dr. Walker, we've had something like, I think, 6 announcements in the past few weeks. Are we really onto something here?
I think one of the things that is happening now is that results have been pouring out of the labs in the last 10 years or so. It's actually a very exciting time in the laboratory. But it's an incredibly frustrating time for patients because they're seeing all this activity and comment and excitement from the scientists without actually seeing something coming into the clinic, which is making a huge difference.
Well, yes, indeed. I mean, cynics say that competing researchers are trying to attract funds by rushing into publication with some pretty untested research. Is there any element of that?
Yes, of course there's an element of that. And one of the things that's happening now, as everyone knows, is that people do like to hear stories about health. There's a lot more communication of this kind of research happening anyway. And what's clear to us, and hopefully to everybody else, is that we're going to have to become real experts, all of us, everyone that's involved in interpreting this kind of material for the public.
Well, let's start with this new invention. What's exciting about this?
What's exciting about the invention is that we've never accurately been able to measure oxygen in tissues. And in terms of cancer treatment, oxygen can affect the outcome. So if you have low oxygen, you may not respond to radiotherapy as well, for example. So what's going to happen now is that we're going to be able to use the probe to develop a whole raft of treatments to begin to personalise treatment better. And that's going to be the way that we're going to see cancer medicine going in the future.
So in a sense, will it make existing treatments more effective?
It will make existing treatments more effective. It will also help us to develop specifically new treatments for problem areas, such as tumours that have a very poor blood supply and, can hang on in there and survive chemotherapy and radiotherapy.
But as you said, from the point of view of patients, it's going to raise a lot of expectations, but presumably a long time before many of these discoveries are ready.
Yes, I mean, people should be aware, I think, that when new results are reported, the very first trials are going to take place. It's going to be a couple of years, really, before we know how useful something's going to be.
Dr. Walker, thank you very much.